Hello, this is Dr. Mike, and I'd like to take a few moments to discuss the hierarchy of post-rehab fitness pyramid. I realize many of our medical exercise specialists and post-rehab conditioning specialists out there now are faced with developing exercise programs for clients with multiple medical conditions. As a result, constantly I'm asked the question, which safety guidelines take precedence? We've developed the hierarchy of post-rehab fitness pyramid to give you clear-cut guidelines on what safety precautions take precedence and, more importantly, which conditions are most important with regard to their safety precautions. The hierarchy of post-rehab fitness pyramid is based on the organ system affected, the most dangerous conditions are given priority, and safety is the primary concern. This diagram shows you the hierarchy of post-rehab fitness pyramid. You'll notice cardiovascular and cardiopulmonary disorders take the highest level here. These conditions are considered life-threatening if safety precautions with exercise are not applied appropriately. Second on our list are surgical procedures. Third on the list, neurological disorders. Fourth on the list, soft tissue disorders with radiating pain. And fifth on the list, soft tissue disorders with no radiating pain. Cardiovascular and cardiopulmonary disorders, as I said, take the highest level on this scale. Cardiovascular and cardiopulmonary disorders include myocardial infarct, hypertension, diabetes, COPD, and any cardiovascular or pulmonary surgical procedures, including valve replacements and organ transplants. These are potentially life-threatening conditions and take precedence over all other conditions. Exercise precautions for these conditions are applied first and foremost when designing a post-rehab program. Second on the list are surgical procedures. These include organ transplants that are non-cardiovascular and non-pulmonary. Total joint replacements, total hip replacements, total knee replacements, total shoulder replacements. Joint reconstructions, ACL reconstructions, high tibial osteotomies, and PCL reconstructions. And any other surgical procedures, examples would be fracture pinnings, tendon reattachments, and arthroscopies. Because of the delicate nature of surgery, surgical procedures are second on our list. We can easily implement an exercise program that may be too vigorous that may actually damage a surgical procedure, so they're second on our list. Third on the list, neurological disorders, or any conditions affecting the neurologic system. These include conditions that cause balance dysfunction, such as vertigo, nystagmus, or any other conditions that affect balance. Second would be conditions that cause muscular weakness or paralysis, CVAs, spinal cord injuries, MS, even Parkinson's disease. And next on our list would be conditions that cause diminished cognitive capabilities, such as Alzheimer's or dementia. Remember, with neurologic disorders, our biggest concern is that these clients will lose their balance and fall, and that will result in an injury. We certainly don't want that, because we've seen on many occasions clients go into the hospital as a result of a hip fracture, the surgical procedure that's involved after that, and the rehab involved after that. Even with the best rehab and surgery, we may still see loss of function, and in some instances, entering the hospital may be the worst thing for the patient and may cause their demise. So with neurologic disorders, they come third because of the potential for balance dysfunction. Fourth on our list, soft tissue disorders with radiating pain. These conditions are musculoskeletal in nature, but the radiating pain indicates a serious situation. An example would be a nerve root compression caused by a disc herniation. The radiating pain obviously means something is serious here, so safety precautions for these conditions are fourth on our list. And fifth on our list are soft tissue disorders with no radiating pain. So the pain here is localized. These conditions are musculoskeletal in nature, but there's no radiating pain. Examples would be meniscal tears, joint sprains and strains where there's no radiating pain. The pain is all localized in the general area of the injury. Again, here's our hierarchy of post-rehab fitness pyramid. Please remember, this pyramid is based on the idea of the most dangerous conditions. Their safety precautions are given the highest level of precedence here. So cardiovascular and cardiopulmonary disorders are first, surgical procedures second, Neurologic disorders are third. Soft tissue disorders with radiating pain fourth. And soft tissue disorders with no radiating pain are fifth. If you'd like to get more information on our medical exercise and post-rehab certifications and guidelines, please visit us at www.postrehab.com. Thank you for listening in, and best wishes in building your post-rehab practice.